Hello, my name is Dr. Morgan Leaf, and I'm here to talk to you today about using virtual patients to assist with student assessment. So I'm going to go ahead and share my screen with you. So let's talk about 5 ways that virtual patients can simplify student assessment. If you're not familiar with what a virtual patient is, let's start there. So a virtual patient is a little bit different from a standardized patient. Sometimes people are a little confused about this differentiation. While a standardized patient is one that is somebody in person who is simulating a patient case, a virtual patient is a case on the computer that students can work through in their own time. Some of the big advantages of virtual patients are that they offer a wide variety of cases on a wide variety of age groups, different areas of medicine, different disease processes, as well as the opportunity to repeat cases that are maybe a little more difficult. So virtual patients can supplement clinical experience with additional volume, variety, and data. And you can see from the numbers here on the screen of surveyed students that a vast majority of them agree that they could practice a larger scale of clinical decision-making by using virtual patients, which we're going to talk about a little bit more as we go on today. And also, they became more confident in their clinical decision-making. So these are 2 very essential skills for our 3rd and 4th year medical students on their clinical rotations, as well as other types of health professional students. And how can we as educators harness this very powerful tool to help us assess students, which is often a challenge. It can be difficult to get enough time with a student to provide an accurate assessment. It can be difficult to get enough objective data rather than subjective data to assess the student. And comparing students in different times of the year, in different locations, it's sometimes comparing apples to oranges rather than comparing them all on the same grounds. But virtual patients offer the opportunity for each student to have the same clinical experience, but virtually. So first way you can utilize virtual patients to assess students is to evaluate their clinical reasoning skills. And I think a lot of us feel that clinical reasoning skills are really what we're hoping our students hone, especially in their later years of medical school. So this is the idea that they have 2 years worth of basic knowledge under their belt, and we want to teach them as best we can how to apply that clinical knowledge to the patients that they're seeing, which we all know from our own experience is a little bit trickier than it sounds, and also sometimes difficult to teach. So let's go first through exactly what we mean by clinical reasoning skills, because it turns out if you look at this in the literature, folks actually tend to have a different idea of what makes up clinical reasoning. And we may talk to each other and use that term clinical reasoning, thinking the other person means the same thing as us. So the steps in clinical reasoning involve, sorry if you hear my dog in the background, that's life, collecting clinical cues. So collecting cues from the patient. What are they telling us? What are we seeing? What are all the important parts of what's going on here? Then taking that information in the second step and processing it. So I've collected all these very literal items, but what do they mean? How should I interpret this to best care for this patient? Putting all of that together, so what you've learned, what you make of it by processing, then you can understand a patient's problem. And this is, of course, what we want to do. Once we understand their problem, we can plan and implement an intervention, and then we can evaluate our outcomes. We all know this is often a very circular process, right? It's not, sometimes it's nice and easy. It's, oh, come in and see me and here's your medicine and we're done. But often it's, okay, let's try this. Let's see how it works. Let's come back and reevaluate this. So we want to get this sort of circular thought process for our students as well, so they understand it's not just put all the pieces together and you're done. And then very importantly for students and all of us practicing medicine is the idea that we need to reflect and learn from the process that we just undertook. So did things work out right? Was there something that we could have done better? And this is a very obviously complex progression that takes a lot of time to perfect. So as we're working to instill this in our students, it would be very helpful along the way to have a tool to show us exactly how that's going. And virtual patients can offer this. So if you are seeing what a student does every step of the way as they are evaluating a virtual patient, then you can see each little step along this ladder here. Is this going well or is this not going so well? Does the student need more help with what laboratory tests to order, what history information to get from the patient? How are we doing with collecting, processing, understanding all of these items along the way? So this can give you a very objective way of doing that. Whereas when you see a student or work with a student in your office or the hospital, they're often kind of telling you their conclusions, and it can be tough to take the time to understand someone's thought process and take the time to break that down and really judge their clinical reasoning skills. But virtual patients can give you a very objective and step-by-step way to do that. So a second way that you can use virtual patients for student assessment is to analyze achievement of required competencies. So luckily, I think evaluation of medical students has changed from who can memorize the most information to how can the student achieve a competency? So something that we all know is important to be able to do when practicing medicine. And when clerkship directors were surveyed about how they used virtual patients, 94% of them mentioned that one of the reasons to use virtual patients in their clerkships was to meet LCME competency requirements. And in particular, a couple of the competencies we have listed here under ED2 and ED8 compensate for variable patient numbers, for variable diagnoses seen, and for variability between sites or services. So if students can complete virtual patients as they go or towards the end of their clerkship, it can really help you get a handle on perhaps competencies that a specific student needs work on, as well as your group of students, your class of students as a whole. And is there a mark in this rotation or a competency that we're not meeting overall? It's not just this one student that isn't getting this, but it's all of them. And that can allow you a chance to step back and maybe evaluate your curriculum and see how that can be improved to meet this need. So a few examples of this, and I think a lot of people already have a sense of this from verbal feedback you get from your students in different rotations and different sites. And there was a study done in 2002 of family medicine rotation sites that noted a great variability in the number of patients seen with a particular diagnosis, as well as great variability in the severity of the disease given a specific diagnosis. So we all know this is out there. We all know if you do your pediatrics rotation in July, well, any year except 2021, you're not seeing any RSV. And if you do your ED rotation at a level 1 trauma center versus level 2, level 3, whatever it is, trauma center, you're going to get a different experience. And we want to see what's happening in real time with our students. What experience are they getting? Is this appropriate to meet the competencies that they need to meet in order to be an effective clinician? And then if not, this helps us with the next step, which is how do we do that? And hey, virtual patients might even be the answer to how do we do that. If it's July in your pediatrics rotation and nobody knows enough about RSV, then you can use the virtual patients to assign more cases to meet this need. A third way to use virtual patients for student assessment is to compare student scores within or across clerkships. So this tool really has a lot of value in this sense in a number of ways. So let's start with the individual student, okay? If on any given clerkship, maybe you have 5, 10, 20 students, and you use virtual patients to assess how they're doing by assigning cases, see the scores, and student A seems to be really behind the other students. Well, it can be really important for that student's overall education to then be able to say, okay, is student A just really struggling with OBGYN? Is this material very difficult for them? Are we catching a student that's having a really difficult time in life for some other reason and just can't keep up on their OBGYN rotation? Or can I look at the data from all the rotations and see the student, this is actually their 4th rotation of their 3rd year, and they've been struggling in all of them? Because obviously the approach to those 2 different scenarios is very different. And it's important to know sort of where students are at an individual point in time, as well as where they are over time. Are their scores getting better? Are they getting the hang of things? Are we really instilling this clinical reasoning? Or are they behind? Are they unsure how to do appropriate self-directed learning to gain the knowledge that they need for a given rotation? What's going on here? So a lot of value, again, sort of in the level playing field, when you don't have something like virtual patients that are fairly consistent across specialties, it can be very hard to compare how a student is doing in one specialty compared to another. A lot of assessment information, aside from standardized tests, which we're going to talk about in a minute, can be very subjective, can be done on different scales, and it's just ends up being an apples to oranges kind of comparison in the end. And a lot of schools also lack a tool to sort of compare students between clerkships. Each clerkship often exists in its own silo. So this makes it a lot easier to see how your individual students are doing over time. And then on top of that, another important benefit is to see how a group of students is doing. So is a group of students particularly struggling right now in a given rotation? Is it because it's the beginning of a pandemic and they're doing family medicine and nobody's coming into the office, so the whole group is not doing well? Is it because, hey, look, all the students out at this given rotation site, wherever that is, they really, it's not individual students. I'm noticing this group of students is really struggling compared to the rest of the students on the rotation. And that can also be very helpful information that often goes back sometimes to working with individual students, but often to taking a step back and looking at the details of the clerkship and the curriculum. Do we need some revision? Do we need some supplementation? What else can we do here? So having a nice broad base of virtual patients to assess how folks are doing compared to each other on exactly the same ground can be very helpful for this type of assessment. So as you can see here, we've already mentioned most of these. You can assess knowledge gaps that may come from the time of year, challenging diagnoses. That's very important because sometimes those might be ones that you don't see very often, or when students do see them, they just aren't apparent. Rotation location or inadequate self-directed learning. A fourth way that virtual patients can be used for student assessment is to appraise readiness for examinations. And this is important on a lot of levels. We use those examinations in medical education to assess how students are doing overall, right? And then we also know, sorry about that, that schools use these examinations to give residency spots residencies look at these examination scores when they're offering residency spots. So we want our students to do well on these standardized exams. So analytic data that can be provided from virtual patients, including general performance, diagnostic accuracy, time, missed tests, unnecessary testing, inadequate reasoning, and number of solved patients, while virtual patients are not the same format as a standardized test, which is typically multiple choice, it can still give you a lot of information for where knowledge gaps may be and how students can better prepare, because we really want them prepared for those important, whether they're USMLE or shelf exams. We want to see students succeed with those. So using virtual patients in a very targeted and specific way, perhaps you want to really target the common diagnoses that show up on these exams, or you want to target those very challenging diagnoses that may show up that you're concerned students didn't get enough practice on in their clinical rotation. You can use virtual patients for any of that. So assigning these can help you appraise their readiness for examinations. And I'll just read you the quote over here in the corner. Medical educators can apply learning, analytic, and educational data mining techniques across a large number of students and institutions to assess educational gains. So a fancier way of saying what I'm saying essentially, which you're going to get a lot of data from a virtual patient that it's just simply not possible to get from either in-person or standardized patients. And harnessing this data can really help you understand where your students are in the learning process. And finally, the fifth way to use virtual patients for student assessment is to provide feedback for areas of improvement. And I know when I was working with medical students in a clerkship, feedback was always difficult. It's difficult on both sides, right? As the giver and as the receiver, because what we want so much is to give students very objective feedback, and we want it to be useful to them and specific, right? Those are all the things that make good feedback. And as a student, they also appreciate objective feedback because it can be hard to hear feedback, right? We want to think we're great at whatever we're doing. And when something feels personal or subjective, that's really difficult. So when you have all this data about virtual patients and how students did, whether it's, you can see what's on the screen here, whether it's in a specific area of medicine or it is with a specific diagnosis like inflammatory bowel disease here, or a specific age range of patients, or in a specific part of patient assessment, so history, laboratory examination, so on and so forth. To have very specific numbers like this really gives you something nice and neutral to present to a student. Hey, look at this. I noticed that on each of these different categories, no matter the specialty, that there was some difficulty obtaining the proper history information from the patient to make the diagnosis. Let's talk about why that is and what we can do from here. And also, of course, we never want to be the person who's only giving the negative feedback to students who are struggling. We also want to note where they're doing a fantastic job, which a lot of them surely will be. So, hey, this is great. Look, you must have had a really great emergency medicine experience because you are just showing you're really excelling in your scores in that area. And then once students receive this feedback, they can work on it on their own. You can come up with some type of plan to work on it with them. There's a lot of options, but they can't be directed in the right direction without first having some data. And I like this system because it sets students up, again, back to the idea of how important self-directed learning is in medicine. They're going to be able to see statistics like this when they're done too. And that's a really nice way for students to say, oh, hey, look, I didn't do well in this. I'm going to go back and read on this topic. And once they start understanding that process, that really lends itself to lifelong learning, which of course is our goal. So that's all on virtual patients for student assessment. Thank you so much for your time.